Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. I will give you in a short video 20 radiological signs in the neuroradiology which are frequently asked in NEET PG exam. Don't forget to download the Incus app. Just rupees 999 only. 3 years subscription, you get 2000 HD videos, 60 full scale grand tests, 70,000 MCQ question bank, 3,500 quiz tournaments, 70,000 MCQs as revision flashcards, and 1 lakh PowerPoint slides of notes. Just for 999 rupees only for 3 years. Now, doctor, empty delta sign. Typically, this is an axial CT after giving the contrast. It shows a non-enhancing lumen of the superior sagittal sinus and it is surrounded by the enhancing dura. Right? So, enhancing dura. And the non-enhanced axial CT, if you look here, it shows a hyper-dense superior sagittal sinus suggestive that there is a thrombus, and this is called triangle sign and empty delta sign whenever there is any superior sagittal thrombus. So, someone taking oral contraceptive pills or any hypercoagulable condition, typically they develop severe headache. That's how the sagittal sinus thrombosis they present with. So this is the sagittal reconstruction of the contrast enhanced CT where you can see in the superior sagittal sinus there is a filling defect is what you are able to see. So empty delta sign, triangle sign. Tomorrow's NEET PG exam, when they ask this question, doctor, you are going to remember Dr. Murli Bharadwaj. Now, what is this called? Dural tail sign. This is called dural tail sign. So this is the axial and sagittal contrast enhanced MRI where you are able to see in the frontal lobe area a enhancing lesion, and the lesion is based on the dura. There is a thickening and enhancement of the dura, and it is tapering away from the mass. And this thickening and enhancement of the dura adjacent to the mass is called as dural tail sign, which is seen in the case of meningioma. Meningioma is what you need to remember. Now, the next favorite radiological sign you should not forget in the NEET PG, FMGE, INICET exam is Medicinal head sign. So this is a T1 weighted MRI which is showing this developmental anomaly. Multiple radiating veins, they look like the Medusa head in the left cerebellar hemisphere is what you are able to see. And post-contrast axial film, typically showing all these developmental venous anomalies, and also you can see a cavernoma. So the Medusa head sign is typically seen whenever there is venous malformations is what I want to underscore. Now what is this? This is called lemon sign. If you take the previous AIMS, PGI, NEET PG, JIPMER question bank, one of the favorite questions, so many times asked. So where do you see lemon sign? Typically in an axial ultrasound, you see lemon sign. You take the fetal head biparatal diameter, it shows a inward convexity of both the frontal lobes. Instead of normal convexity, it will show inward convexity is what you need to remember. And this is typically a feature which you see in the case of the neural tube defects, and the myelomeningocele you can be able to see in the sagittal ultrasound in the lumbar area. Now this is called pancake brain. This is called pancake brain. So whenever there is a yellow bar, lobe has not developed well, yellow bar holoprosencephaly, it shows the fusion of the cerebral hemispheres with a single ventricular cavity, and also you can see the fusion of the thalami. Pancake brain is the next radiological sign for the tomorrow's NEET PG exam, doctor. Now, reversal sign क्या होता है? So you have taken a non-contrast CT scan axial view with low attenuation of the cerebral hemispheres, complete loss of the gray-white matter differentiation, very small temporal horns, relative preservation of the cerebellum. Cerebellum is relatively preserved, and there is a hyperattenuation, increased intensity of the cerebellum. That's called white cerebellum. What is this called? White cerebellum. And typically you see it whenever there is a severe head injury in a child, is what you need to remember. The next neuroradiological sign par excellence, which is favorite question of the NEET PG entrance exam, doctor. Don't forget to and tell all your friends to download the Incus app. You have 2000 HD videos, 2000 hours, 2000 HD videos, full scale grand test, 70,000 flashcards, beautiful feature of Incus app. Nowhere else you get that kind. Flashcard means you can do revision. Just on the front of the flashcard you can click, and behind that you have the explanatory answer, detailed explanatory answer. And you can bookmark the flashcards, and last moment before exam you can be able to do the revision of those bookmarked flashcards. That's how we have placed 70,000 MCQ bank. Everything just rupees 999 only. Cheaper than taking a girlfriend to a movie or a boyfriend to a movie, right? You get just for 1 rupee. At 1 rupee per day cost, 3-year subscription of the Incus app. So don't wait, tell all your friends to download and enjoy instead of wasting 60,000, 70,000, 80,000 here and there in that package, this package, that plan, this plan and all that. Hyperdense MCA sign क्या होता है? These are the non-contrast CT. This patient had a sudden onset of, and there is a hyper attenuation of the left middle cerebral artery. You are able to see, I'll show you. Left middle cerebral artery, there is a hyper attenuation, and that suggests that there is an occlusion of that artery. This is one of the signs of the acute stroke, but does not always represent infarction. Salt and pepper sign. So this is a fluid attenuation image, flare image of the left temporal lobe, which is very iso-intense in the where there is a mass. It is iso-intense in the region of jugular foramen, and this mass is heterogeneous, and typically there is a mass destruction of the surrounding bone. Surrounding bone is destroyed, and an angiogram is showing the tumor blush. So this is typically glomus jugular tumor, where you get the salt and pepper sign. Then optic nerve tram track क्या होता है? अगर आप कोलकाता गए तो tram track ब्रिटिशर्स के जमाने में tram track. So typically here you are able to see that there is a meningioma which is arising from the optic nerve sheath, and there is a fusiform enlargement of the left optic nerve. So this is a case of optic nerve glioma, and this is a optic nerve meningioma. That's what you need to remember. Now this is called bare orbit sign. Bare orbit sign. So in a patient who has got neurofibromatosis, so what you can see is the wings of the sphenoid, the greater and lesser wings of the sphenoid, typically they are smaller. I mean, typically you can be able to see them. And axial CT is showing a anterior herniation of the left temporal lobe, and the left globe is small and calcified, which is called phthisis bulbi. So this is what you see in plexiform neurofibromatosis. Bare orbit sign is what you need to remember. Moya appearance. Where do you see? There are small tortuous collateral vessels in the distribution of the middle cerebral artery, and it looks like a puff of smoke appearance. And so this is what you typically see. The moya appearance is what you need to remember. Then यहाँ आपको एक cheetah दिख रहा है ना, cheetah, tiger. It looks like the eye of a tiger, because of the hypointensity of the globus pallidus. And this condition is called Heller-Woden-Sparge syndrome, is what you need to remember. Then here you are able to see एक महर्षि के आश्रम में एक टाइगर के चमड़े के जैसे बन गया. Tigroid appearance. Whenever metachromatic leukodystrophy is there, then there is an increased signal intensity of the white matter with the sparing of the subcortical U fibers. And that typically has got like a leopard skin, tigroid appearance in metachromatic leukodystrophy. Finally, this is called hot cross bun. So hot cross bun sign. Whenever there is a multi-system atrophy, you can even be able to appreciate here. There is an atrophy of the cerebellum and also cerebrum, and cerebellum also. The folia became very prominent. That means there is an atrophy. So this condition is one of the Parkinson plus syndromes. Multi-system atrophy. You get the hot cross bun sign is what you have to ultimately remember. So that is quickly the important neuroradiological signs for the tomorrow's NEET PG exam, doctor. Thanks for the patient hearing.